they have shown markedly reduced morbidity and mortality, and that too with the prophylactic way of treatment. Almost the children with hemophilia in the developed world are almost playing sports, and they participate in lot of activities, unlike here. And also the establishing comprehensive hemophilia care center, it promotes research and development, especially ours is an institution. So you will have lot of material in the patient, number of patients, different category of manifestations, the laboratory diagnosis, inhibitors, transfusion transmissible infection. So much of material will be generated if you have CHC in the medical college, so that the postgraduate students of different departments can be given some dissertations or theses, and even nowadays we give small studies to our undergraduates, ICMR projects, so that will promote this kind of research and development and public health activities. So hemophilia needs a lot of awareness creation, because it is known as low volume, high cost disorder, because the general public is not aware. The medical and paramedical professionals still needs empowerment. So because of all this, we need to create a massive public awareness. And government policies, yes, as an non-profit organization, NGOs, we have been trying our level best to advocate with the government to bring the government in hemophilia care, not only to bring, even to mount pressure on changing some policies which are not ideal in general. So optimum care is needed for hemophilia, because it helps us for good quality of life and good quality of life of our children and youths and the various patient groups, family, will definitely result in the productive society. We are also equally competent to contribute to this society. Only thing is, we need to be supported in certain ways. So care for rare chronic blood disorder is less than optimal in our country. So in the life, if you go back to around 20-30 years back, so situation was really bad. But nowadays, thanks to the government, especially the National Health Mission, so which has changed not only hemophilia scenario, but also thalassemia and other rare blood disorders. So optimal care is good for patients, good for their families, and good for society as a whole. So all this is possible in RIMS. RIMS, because it has the knowledge, it has the resources to provide such an optimal care. Because we have all the departments, pathology department, orthopedic department, we have emergency care, so what not. So everything is here. But only thing is, we need willpower or mindset in bringing together all these facilities and start one comprehensive hemophilia care center. Our goal for comprehensive hemophilia care, especially for our healthcare providers, is to provide the best possible care available to the person with hemophilia, to educate the person with hemophilia. It is not just giving factor and sending them. So we need to educate them. We even, if possible, in the coming days, if government accepts for low dosage prophylaxis, even training himself in future. So all these things are needed, and to enhance him to live as normal and productive a life as possible. So that's why you should consider persons with hemophilia, they are normal people, but with an abnormal situation. We need to change this situation. We need to create a conducive atmosphere to live normally as far as possible. So what is the basis of comprehensive hemophilia care? Yes, naturally you need clinical interventions. It may be physician in case of adulthood patients, pediatrician, orthopedician because of the MSK issues. And diagnosis is crucial, as Dr. Sita Lakshmi highlighted how important it is to detect factor deficiency. Because without factor identification, you cannot think which factor to be given for the treatment. So laboratory technician also is important. He needs to be trained. And rehabilitation, as physiotherapist, orthotics, so complete rehabilitation department is needed. And psychological, our friend is here, so I have been telling him, because hemophilia is a chronic incurable disorder. The moment they come to know that it is lifelong, they become depressed. Why God has given hemophilia to me only? So all these questions will arise. There are a lot of issues while growing in the family. When he starts going to the school, even school surroundings, teachers, and even because of the school absentees, so they don't get proper education and they land up in very bad jobs and ultimately affecting the whole quality of life. So that's why we need a psychologist or psychiatrist to counsel these families to accept hemophilia and how to live with it. Genetic counseling is preventing the expensive hemophilic children. The birth of these hemophilic children is also very, very important, especially in our country. So that's why prevention by carrier detection, prenatal diagnosis is needed. For this we need a medico-social worker who knows, who understands, who takes the family into confidence and educate them what are carriers, who needs prenatal diagnosis and all those. So dentist is also an important part of our comprehensive hemophilia care because these patients tend to bleed and some of our patient families, especially mothers, they don't allow their children to brush their teeth. So this is bad. So keeping good oral hygiene is also important. That's why annual checkup we promote to all our families to undergo a dental checkup and all that. Then patient group representative. I always tell our hemophilia families, so you should be organized first. We cannot expect help from, these are all doctors, they have a lot of other priorities. It is not just, hemophilia is a part of their profession. So you need to be organized and you need to support them in organizing meetings, taking notes and documentation and all those things. If educated family takes care, then our doctor community can give a good care. And coming to nurse role. So especially in our country, we have not given much importance to nurse in hemophilia care. But the nurse in the Western world, there they don't call staff nurse, they call nurse coordinator. And nurse is the one who coordinates. Because we doctors are all busy in our other aspects. So whatever the consultation is needed, this nurse will talk to the doctor, fix up an appointment so that there is optimum utilization of resources as well as time of the doctors. So that's why better to make the nurses as coordinator of comprehensive hemophilia care. So naturally the medical director, everywhere hematologists are not available, but physician or pediatrician may be considered as a director, medical director of this program. And coordinator, as I told you, nurse can do that, and psychosocial professionals, and one assistant maybe from your department office only can give. And extended team, as and when it is needed, some special occasions, you need the support of these professionals, like a pediatrician, internist, family practitioners. So it depends upon, even if any HIV positive, how to manage, or any gastroenterology support, or any surgery support, neurosurgery to manage CNS bleeds. So as and when it requires, we can arrange the treatment. And we should have a field or outreach services also. So outreach services, because still many patients needs to be identified. So just around 20-25% of hemophilia population is identified and registered. Nearly around 75 to 80% still they are not identified. We have a lot of work to bring them into the network of medical services. So it also enhances the medical college reputation also. So once patient starts coming, already around 20-25 hemophilia families are in this room, and so you will start creating your own registry. So nowadays documentation is very important. You can say I have a registry of these number of patients, so that will help you to approach any research or any funding agency for the support. So that is the power you are going to get that. Then public health research, then education and prevention, access to specialty care and laboratory, and new drug development. All these are all indirect benefits and long-term benefits. So we cannot expect overnight, but you know MCI is insisting Department of Transfusion Medicine. So in the coming days, but now itself if you are prepared and if you start working on this, it becomes easier for you to keep up the compliance of the MCA in future. Yes, it not only hemophilia. It not only, you start with hemophilia, you will see the lot of other patients also starts coming to your center. And who knows, you may start hematology department tomorrow, clinical hematology department. So because the one is clotting disorders, bleeding disorders, and there are red cell disorders like hemoglobinopathies, thalassemia, then leukemias, then bone marrow failure syndromes. So a lot of these issues you can empower the institute to take care of these patients. Then before concluding, just actually I was asked to deliver a lecture on Scenario of Hemophilia Care. But when I came to know that Dr. Banakar, who is a nodal officer, is coming, I thought he is the right person to talk on the scenario. So that's why I prefer to talk on comprehensive hemophilia care. But since just briefly I will cover the scenario of hemophilia care. So it all started, as in the morning I told, so it started with death. So people used to die of life-threatening bleed or the very bad hemophilic arthropathy, deformed arthropathy. The quality of life was very bad around 30-40 years back. So as I told you, I am the live witness of a death of my maternal uncle due to intracranial bleed. So that time factor was not, I will not forget factor, he was not known which factor he was deficient of, because in whole Karnataka basic coagulation profile facilities were not available. So that's why I have put this, the scenario has changed. So now our promise is, our medical community promise is, none shall die for want of treatment. So at least, yes, we are able to give factor immediately and save our patients from life-threatening bleeds. And hemophilia without disability, children free of pain. Of course, the mortality rate almost it has come down, but morbidity still continued because we follow episodic treatment. Whenever we have bleed because of the, as Dr. Cecil pointed out, because of the issues, local issues, we are not affordable. But nowadays, scenario has changed. Government is giving free factors. So at least now we should think that the hemophilia without disability can be made possible, and our children should be free from pain, and they can go to schools, they can go to colleges, they can get good education and place in gainful, productive jobs. And it certainly improved quality of life. So I am very happy to share with you. I have motivated my blood brothers. So 2 of them have become doctors, and nearly around 8-10 people have preferred the computer engineer and software engineers. They have become. Why? What I tell them every time. So like your father, like your parents, you cannot work in fields. So you have to have a not just job, very good job, which will bring lot of money, so that you can keep your health in a very comfortable way. So you can manage. You should be able to buy any amount of factor tomorrow. So if you want to place in this situation, you have to read very carefully, hard, and try to compete, because in this competitive world they have to compete and get ranks. So that I am very happy to share with you. So many of our blood brothers, they have scored more than 80%. Here in education, he has scored health inspector 82%. And here only Mr. Naveen, he has completed his BCom and MBA, and he was searching for job. I told him, so instead of searching job here and there, why don't you take our society's executive officer post and run the organization? Now he is appointed as executive officer of our Hemophilia Society, and he is working very well. And I have seen him since 6 months of his age, and just you can compare my problem and his problem. Can you imagine that he has got hemophilia? So he's, because he was treated well. We did not get treatment. So now that's why disability, we were victims of disabilities. But now our youths are not disabled. They can definitely lead a very qualityful life. Integration of hemophilia care in healthcare system. Already very happy to share with you the National Health Mission is involved in hemophilia care, and I am proud to tell that the government of Karnataka is the first government in the whole country to come into hemophilia care in 2005. And I must share this experience. Actually, this Kagodu Timmappa was then health minister. He was health minister. We invited him for Bhumi Puja of our chapter treatment center. So we invited him, he accepted, and he came. But on that day he was telling that you call local people, I will come for building inauguration. No sir, anyhow, we got hold of his classmate, and who was very much stubborn. I don't know what you are going to do. You have to come to Davangere, because Bangalore it is easy. Coming to Davangere, he was not ready. So, but somehow we brought him to Davangere, and that time I did one homework. This is again a tip for our hemophilia families here, an effective advocacy. What we did, there is one family from Sagara where Kagodu Timmappa's the constituency. Okay, he was a health minister. So just 1 year back, what had happened? This family had 2 children with hemophilia. One child had, while eating chocolate, bitten the lip and started bleeding. And they went around Sagara. They came to Meghan Hospital. So bleeding did not, more than 1 week, the bleeding was continuous. And by that time, someone has told, go to Davangere. By the time they came to Davangere, the child was in shock, and we tried to start the treatment, but the child had cardiac arrest and died. And I told that this family was cooling in a coffee plantation. So I told the mother, the health minister is from your constituency. You talk to him, you tell your story, this how you lost your child. Then the Kagodu Timmappa was so much touched. ಏನು ಡಾಕ್ಟ್ರೇ, ಒಂದು ಚಾಕ್ಲೇಟ್ ತಿಂದು ಹೋಗಿ ಒಂದು ಮಗು ಪ್ರಾಣ ಕಳ್ಕೊಳ್ಳುತ್ತೆ ಅಂದರೆ, ದಿಸ್ ಈಸ್ ದ ವರ್ಡ್ he told on that day. Then he asked what should be done. So these medicines, expensive medicine, must be
made available in the government district hospitals. And our government doctors needs training. And he immediately arranged a one-day training in that Magadi Road Government Health Institute. And he initiated the process of availability of the factor. But anyhow, it took nearly around 3 to 4 years. By Cheluraya Swami period, it came into effect on the district. It started with few district hospitals, that too with a tag of only BPL category. There also we fought with the government. How can you, because one child in a family with hemophilia, however rich he is, if we have one child with hemophilia, over the next 10 years, he has to apply for BPL card. So that is the situation. Then I gave my own example. I work in a medical